The heart-lung machine, setting up of the extracorporeal circuit. Open heart surgery requires extracorporeal circulation. This video demonstrates the equipment and procedures for setting up of the extracorporeal circuit. The most expensive and technologically advanced is the pump. This modern 5-pump console is commonly used in most heart centers. The first, or the red pump, is the arterial pump. The other 4 pumps are used for cardioplegia delivery, cardiotomy, suction, and intracardiac vent. They are color-coded. Several monitors are available as accessory equipment. These monitor the arterial pressure and temperature, the hematocrit, and arterial oxygen saturation and cardioplegia delivery pressure. The next important equipment is the TCM, or the temperature control module. This can cool and warm the patient and the cardioplegic solution. This is a disposable hard-shell venous reservoir combined with a membrane oxygenator. This is for adults. It has an integral heat exchanger. These are custom tubing packs made according to the specifications provided both for adult and pediatric perfusion. The next equipment is the pediatric oxygenator. This also has a hard-shell venous reservoir, heat exchanger, and oxygenator. These are wall sockets for central supply of oxygen and compressed air. The 0.5 micron arterial filter is an integral part of the circuit. The blood cardioplegia delivery is another disposable item in the circuit. The second pump is used for cardioplegia delivery. The tubing permits mixture of blood and crystalloid cardioplegia. There is a recirculation line that connects to the venous reservoir. In setting up the extracorporeal circuit, the perfusionist takes full precautions to avoid contamination. A filter is used in the oxygen inlet line. One set of tubing is used for assembling the arterial line. It is important to ensure proper connection of inlet and outlet ports. A separate pack of tubing is taken by the surgeon on the table. The cardiotomy suction lines are connected to the venous reservoir inlet. The venous tubing for adults is usually half-inch diameter. The arterial line is 3/8 inch in diameter, and the suction lines are 1/4 inch tubing. One end of the venous line and one end of the arterial line are connected to the respective ports. The arterial line is connected to the 0.5 micron filter with a bypass line. An arterial pressure monitoring line with a one-way valve is connected to a manometer. The water lines from the TCM are connected to the heat exchanger. And cardioplegia delivery system. A crystalloid priming solution is infused into the venous reservoir. Heparin is added to the circuit. The composition of the priming solution is shown on this slide. The prime is now circulated and all air is removed from the lines. The occlusion test is performed on the arterial pump. The pump head is adjusted for no more than 1 inch fall in height per minute. The arterial filter is deaired. The cardioplegia line is deaired. The priming fluid is vigorously circulated. This is a bubble oxygenator. It is historical and most perfusionists use a membrane presently. Another equipment is the cell saver and requires a separate kit of tubing. It is not used in all perfusions. The hemofilter is useful in patients with congestive heart failure and for pediatric perfusion. It is available in two sizes. The blood volume required for perfusion is calculated using this formula. The circuit selection is based on body weight. This is the circuit diagram. Perfusion during open heart surgery has now reached considerable sophistication. The use of the oxygenator, tubing, cardioplegia, hemofilter, and cell saver is dependent on the surgical procedure and the surgeon preference protocols.